Valgus is when the knee under load is moving to the inside, and varus is when it's pulling to the outside. She has a little bit of both, so what I'm doing is I'm getting into the outside, trying to get her internal adductors to do their job, and then I'm going to come around the other side. We're gonna attack it at both angles. So now I'm going to pull it to the inside, which is valgus. Force her external hip rotator, the glute, iliotibial band, to do their job. And this is a automatic PNF correction. So we want that knee under load as we're moving into single leg movement or a single leg squat / lunge. Push your knee a little bit forward, hon. You're pulling back. Now go down. Doing a split squat like she's in right now, we're putting about 60% of her body weight on that front leg. So we're beginning to train more functionally in a split squat than an axial loaded squat. The body is moving on one foot and then the other. So what we want to keep from happening is that knee moving from left to right, or valgus or varus. So when I load, the knee is moving around. This is obviously a meniscus connective tissue issue. Then it gets into the hip and lower back. So now go single leg, Wendy. Watch your knee in the mirror. See if you can load that hip. Drive your hip out. Chest and head stay straight up. Don't exceed 45 degrees at the spine. So that first little movement, right, your knee popped out. Get your hip to do that. Pop your hip out. Tight lower back, tight abdominals, brace, drive out of that. Good. So it's hard to see from that angle, but just that little bit of warm-up that I just did, you'll still see she's wanting to go a little bit valgus and then sometimes a little bit to the outside varus. And what we're trying to do is to keep that knee planted straight forward over top of the toe. Once again, no more functional training possibility than beginning to load one leg and learning how to balance on that leg and get these muscles to stabilize and also be the primary mover that they are meant to be. Ducks right away. So we know leaning back while we're squatting is probably not a good idea. Now I want you to flex at the waist where your head comes forward of your toes. I want you to imagine there's a wall at your toes, okay? Your head's going to go right through the wall. And squatting. Flex forward and squat. More. Yeah. Flex forward, head forward. Now sit. How's that feel in your lower spine? Nope. Doesn't feel too good, does it? Nope. Now, find that neutral spine again. And I want you to flex at the ankle, knee, and hip, starting with the hip. It goes boom, boom, boom. And keep that neutral spine and sit as low as you possibly can. Get this from the side view and see how her nose stays behind the toes. So now the center of mass is on her body. You feel anything in the erectors? No. They're just stabilizing the spine as you move into these big primary movers, right? Keep going. Concentrate. Get that hip back. Hip back. Drive straight up out of that hole. Chest and eyes stay up. You're slightly looking down. Don't look up this way. Look straight ahead. And keep your eye position there as you go down. If you look down, look down. Watch what happens to her spine. Look up. Now look down. You'll see the break start to happen at the T and lumbar intersection. The rhomboids cave. They go forward. Shoulder blades open up, and then right here you'll see the break. Not what we want. We want that spine as straight as we can get it. Awesome. How you feel? You're working hard. 83%. I love it. Grab a quick water. So, a lot of stuff that we're covering. So now we're going to get into a little bit of fancier type movement. We're going to take that functional single leg lunge and we're going to make it hyper functional. We're going to do some contralateral, big word, contralateral movement. So think about running, okay, or walking. If I step left on that one foot, my right arm is swinging forward. Energy is coming from the floor through the kinetic checkpoints, the ankle, knee, and hip, and then it goes across my body. We don't move like penguins, right? And we don't hop like bunny rabbits. we walk on one foot, and then energy comes through and moves this way. So doesn't it make sense that if we want to train functionally, we replicate those movement patterns? That's what we're going to do with Miss Wendy here. Keep your spine at least 45 degrees. And then we're going to curl and row on the opposite side. Shh. Sound fun? So you can see the transverse twist. I'm working sagittal, transverse planes, a tad of frontal. So I'm moving into three-dimensional movement, which is how the body is moving all the time. Let this go as you sit. Okay, so this will anchor your hip. Reach, sit back with the hip, stand up, row, slow down a little bit. And let your shoulders, as you do it, row, let your shoulders just twist in that transverse plane. So the shoulders twist, guys. The lumbar spine does not have a lot of twist to it at all. And we really shouldn't be practicing too much of that. The shoulders, however, have a lot of rotation. You think about running, your lumbar spine is not twisting. Your shoulders are. This is contralateral, single leg lunge, row with a bicep curl. Palm up. Hear the breath as well. So she's learned well. Inhale. She's going to exhale through that exertion phase. Normally, the end range of motion follows the end range of breath. Shh. I'm done moving. I'm out of breath. I inhale, expand. Rib cage expands, especially moving into the bottom of the squat or bottom of a single leg lunge. I'm expanding, contracting. Let's do one more. That poor hip, your butt's going to be sore for at least 3 days. That's awesome. Awesome. So that is functionalizing dysfunction 101. Well done. Okay, guys, so you just went through a 30-minute corrective exercise routine in which I was able to keep a client roughly at about 80% heart rate max. So they got a lot of value out of that, a lot of work out of that, and not to mention the amount of corrective exercise that we went through. So guys out there, especially my male viewers and clients, give yourself the opportunity to explore different types of training, mobility and corrective exercise. Assess and watch how you're moving and be open-minded about that. If you've got faulty movement patterns and you're not dealing with it, they are going to end up in injury or, as you age, complete and total dysfunction. So by the time you're 45 years old, your body will not be moving. You're going to be in a lot of pain. Really important, guys, that we're looking at functional movement screening. You've heard me talk about before. Looking at why the movement patterns are not functioning correctly. How do I then bring in corrective exercise, stretching, and also SMR, self-myofascial release, foam rolling. So that's just a little glimpse of how we get into some corrective exercise and still get a great workout.